Well, thank you very much. People will be joining through the webinar, and we'll be making this recording available afterwards as well. So you can share it with colleagues. But just want to say thank you for taking the time to join us. I was going to say this evening. In the UK, it's this evening, but I'm conscious that well, it's different hours. So thank you for taking the time to join the webinar. So over the next 45 minutes or so, we'll be talking about data requests. So data requests, just for those that don't know, are the rights that we have as citizens of the state that we live in, or parents of young children that we have that might be in education. It's the rights that we have as healthcare patients, as employees, as prisoners, as journalists, and lots of other professions where we have the right to request to see the information that organisations hold on us, or the information that organisations hold that we want to see, particularly if we're talking to public sector organisations. Now, the number of data requests that we have been tracking over the last couple of years has been steadily increasing. In the UK, it's about a 60% increase every year, and the US isn't far behind. And there's a number of factors that are driving the increase in data requests. The biggest one being understanding from the public that they have this right, and they're exercising that right. Underpinning these data requests are a number of different pieces of legislation, and each different sector has slightly different requirements that organisations must adhere to if they're going to be processing data requests. And during this session, we're going to be focusing on some of those different privacy laws and talking about the requirements that organisations must adhere to if they respond to data requests. So helping us do this and helping us understand the requirements, as I've been joined by a couple of panelists. One is Debbie Reynolds, who is a very well-known privacy expert, goes by the name of the Data Diva. And when I pass over to her in a few moments, I'm sure she'll be able to talk to you about some of the great work that she's doing in this space, because certainly what we found is the privacy legislation is just getting tougher and tougher. The regulators are starting to flex their muscles a bit more every year with slightly tougher legislation. And it's becoming very hard for organisations to keep track of everything. So people like Debbie can help organisations really start better understanding their requirements and making sure that they don't fall foul of the legislation. So Debbie is someone that we've been working with for a number of months, and we're really, really pleased to be associated with her. So Debbie, thanks for joining us on the panel today. My other panelist is Greg Tennyson from Xerox. So we're really excited to be working globally with Xerox. Xerox bring an awful lot of expertise and technology to the solution stack when having to request or respond to data requests. So Greg will be talking about, some of the bigger technology issues that need to be considered when putting in place a scalable process and solution to enable organizations to respond efficiently to data requests. And finally, is myself. My name's Darren. I'm the Chief Revenue Officer from Smartbox.ai. So we are the current technology company of the year in Britain. We picked up that award last month, and then last year at the same awards we were named the AI Company of the Year. And I'll be following Greg and just explaining a bit more about how Smartbox can really help you process and find the personal and confidential data that might be residing in some of these data sets that you need to review in order to complete a data request. Okay, so as panelist, the running order, as I mentioned, I thought we'd start with the legal landscape because it is a bit of a minefield out there. And Debbie's going to be covering just some of the legislation specifically around the public sector. But I know there are a couple of people on this webinar who aren't in the public sector. And what's interesting about those organizations or people that aren't in the public sector is that even though you might be based in the US, depending on the type of company that you represent, there are many global privacy regulations that you may well have to adhere to as well. We have done a lot of work with US companies, and some of the companies that we help in the US are companies that actually have to adhere to the UK GDPR or the European GDPR due to the data that they're processing. So if you are not in the public sector, then I'm sure you'll get some value from this. But if you are, then Debbie's going to be talking through some of the regulations specifically relevant to the public sector. And then after Debbie, I'm just going to explain or just talk about some of the challenges that we see in the marketplace about responding to some of these. And then I'm going to hand over to Greg, who will talk a bit more about the work that Xerox are doing in this space and how they can help you get ready for this transformational journey that we're all going on at the moment. And after Greg's painted that high-level picture, I can talk a bit more in detail about Smartbox and the solution that we have to solve this growing problem that's becoming ever more complex. If you do have questions, please put them in the chat. We have a couple of people that are keeping an eye on the chat, and then we'll answer those as we go. But without further ado, I'm going to hand over to Debbie. Debbie, if you could perhaps introduce yourself, and then I will be happy to click through for you as chief clicker.
Well, thank you. I really appreciate it, Darren, and thank you to Xerox for having me on the program today. So my name is Debbie Reynolds. They call me the Data Diva. I'm the founder, Chief Data Privacy Officer at Debbie Reynolds Consulting. I work at the intersection of emerging technology and data privacy. I also have the #1 data privacy podcast in the world. We just passed 250,000 downloads. It's called the Data Diva Talks Privacy Podcast, where I talk with industry leaders around the world about information that businesses need to know now. This is a very interesting presentation. I think it's a very important one because I feel like public sector probably has a lot of the pain of what it means to manage data, but maybe not as much exposure as it should be. So this is an excellent way to talk about this. I think Darren hit the nail on the head when he's saying that there are more requests now. I think especially with things like ChatGPT, it may be even easier for people to make requests. Maybe they weren't going to make those before, but I think that is the future where there will be more requests to the public sector for information. Also, another thing that is happening that impacts public sector is that there is data now being produced that maybe wasn't produced before, or data that's being collected that was never collected before, and it creates more obligations on public sector, especially around removing things from data sets or removing things from that they have to give to the public that may not have been considered private or in the past. So let's go to the next slide. So I want to start with a little bit of something that's in the news. The Illinois Attorney General actually has a voter privacy lawsuit. So there was an organization, the Local Government Information Services, that published voter data. So publishing voter data, there's nothing wrong with that. The problem with this voter data that was published is that it had a lot of personal data in it, including people's birth dates and their addresses. And the lawsuit is really because they want to make sure that this data isn't being used for identity theft, right? Because they know where the person lives, they know their birth date, and maybe someone who has nefarious intent can get additional information and it becomes like a risk. So some of these data points many years ago may not have been private or may not have been considered private or may not have been considered something that creates more risk for the individual, but we're seeing more of that now. So there is going to be more a look at the types of data the public sector collects. There's obviously there are going to be so many more things around the data sets. The data sets are growing exponentially. I've talked with agencies that are, for example, every 25 years they have certain documents that become public And what we're seeing now is that we're going up a hill where, 25 years ago, if you think about what was happening 25 years ago, the internet was new. People weren't creating as many documents or data sets as they were before. And that exponential growth in data in the last 25 years will definitely change the way that we do handle data in the public sector going forward. Next slide. So freedom of information, you're all familiar with this in terms of what a public's right to know is, and then also trying to balance that with what data, obviously, that has to be taken out of there, but then what these new laws or these new obligations or even expectations for the public around data that gets exported or sent out about them. So there's also national security concerns and the need to obscure data as there's more data, again, that's collected, more data on these documents, the more need to have more robust tools, especially when we're thinking about things like producing things that were in Excel spreadsheets. I know, I've seen people have, 10,000 page Excel spreadsheets printed, right? So being able to have a way to look at these electronic documents, not having to make them paper and then try to make them electronic again, that's like a huge problem. So in order to do that, you really need to think about the data components, think about the new obligations, and also maybe new data that you had not ever thought about before that may be considered now to be, sensitive data, personal data, or personally identifiable data. Next slide. HIPAA, of course, HIPAA compliance is really important. And I think people who do HIPAA and understand HIPAA compliance understand why this is such a big deal. But I think one thing that's happening that maybe people aren't thinking about is that there may be organizations that are dealing with health data, what is deemed in the US as personal health information, which may not traditionally fall under HIPAA, but they may also have additional protections that may need some type of redaction in them. So thinking about for example, like the breach of security rule, the FTC, when companies or organizations are dealing with people's data that is not considered HIPAA. So HIPAA is more around a patient-provider relationship. So as we see people using things like health apps or Fitbit or different things like that, there may be a need to actually think about, what are the obligations for organizations that use these apps, especially if they aren't in a patient-provider type of situation. What can you do to be able to meet your obligation, to be able to maybe satisfy a consumer request to see that data, but then also do it in a way that doesn't create more risk for the person and doesn't create more risk for the organization. Next. And then data subject access requests. So data subject access requests, actually that term or that phrase comes from Europe, actually the GDPR, the General Data Protection Regulation. That law went into full effect and enforcement in 2018. But what has happened since then is that many jurisdictions have borrowed liberally bits and pieces of the GDPR. And we see the US, especially on a state level, has really adopted this term, which is data subject access requests. So data subject access requests are newer features that we're seeing in laws and regulations around personal data. We see states that have more comprehensive data protection laws around what maybe private companies or other organizations have to do around data. So part of that is being able to give people the right to be able to see what the data that they have, be able to possibly correct or rectify data, or definitely just send them information about information that they have. And so I think it creates more risk, especially you want to make sure, first of all, that you're sending the data to the right person, but then also you're not divulging information that may create more risk for that person when you're doing those types of things. So some of the laws that we can think about, there are many more. I think there are more state laws being passed every day. I've lost count in the last couple months, but the big ones are, in California, Colorado, Connecticut, Virginia, Utah, especially right now. These states have specific rights or specific obligations that they never had before. And I think that especially because the public sector has had more experience with these types of requests, these states will be leaning very heavily on the expertise in that area. But the idea is the same, to be able to give information to an individual who requests it, do it in a way within, a lot of these requests are time bound, meaning that they have to be done within a certain time period. They want to be able to safeguard the data to make sure that they're not divulging any sensitive or personal information that may cause harm or risk to the individual. And then they want to do it in a way that, makes the person feel whole and gives them the information that they need or have asked for. So when we think about these data subject access requests, the most of those requests are around access, deletion, disclosure of personal data. And sometimes that happens, for example, maybe in categories. This may be in certain documents, and it becomes difficult, especially if these documents are things that are shared in databases, maybe even emails or things that have other people's personal data in it. So it just becomes a lot more complex. And I think we've already reached a place where it's basically not possible to do this type of redaction or handle this massive amount of data, to do it manually, right? Because I've seen people try to, you print a page out, you take a magic marker, take a pen. It's like, okay, let's just, get this information out, and then we upload it into a PDF and send it to the person. Like, that's not going to be possible. That's not going to be feasible in the future. So as the data becomes more complex, it becomes more voluminous, you have to find ways and technologies to be able to help you do that process. Next. I think that's it.
That's it.
All right.
Thank you, Debbie. Yeah, some interesting points there, actually. I want to flick on to the next slide anyway. So we've been in this space now for 7 years, and we've built a piece of technology specifically designed to help organizations respond to these data requests. And there's a lot of challenges associated with responding to them, whether they are regarding health or whether they're regarding children's medical records or whatever it is. But there's a few key ones that I'd like to just highlight here, and then between myself and Greg, we can address them. The first is actually collecting the data in the first place. So as the request comes in, whether it's health or education, or if it's around freedom of information or employee DSARs, someone's got to go and find the data in the first place. So that can be very problematic, particularly if a number of different data sources are having to be interrogated. So that can be challenging. The other part that's very time consuming is that when you have gathered this initial data set, what you'll find, what we've certainly found over the last 7 years, is there's an awful lot of duplicated information contained within a data set. So whether that could be, email threads that have been duplicated or assets within a data set that have been duplicated, there's an awful lot of information that could, if it was removed, it would save a lot of that time it takes to review. So that also can be quite problematic. Debbie touched on, I think, handwriting as well. So again, we have a number of organisations that still have handwritten notes, whether they're doctor's notes. I mentioned prisoners earlier. We do quite a bit of work over in the UK with the prison service, and a lot of the notes that prison officers take are handwritten. So if you're having to review and then redact handwritten documents, that can be very time consuming and very costly. Foreign languages can be problematic as well, particularly if a data set contains multiple different languages, because that could involve having to bring in multiple different people that can speak the different types of languages. But I think one of the biggest challenges above all those actually is detecting the data that belongs to the subject or the data that is in the data set that belongs to somebody else, because that really is the nub of this. If that data, if someone else's data is shared without their permission, it can be very costly to them, and the regulators don't look too kindly on that. I'm going to skip over the collaboration piece, although that is something that we see occasionally. The other area that I'd like to spend a bit of time is this bulk redaction. Debbie mentioned that some companies are printing off and photocopying, whether they're printed notes or handwritten notes, and they're getting a black pen. We've have a number of customers in the UK that do exactly that. I was at the Housing Association just yesterday, where one of the women I was talking to said their biggest problem was actually finding a black pen that was sufficient to actually redact documents before they photocopy them. So, if you've got a lot of documents to review, whether that's as part of a freedom of information or any other disclosure, that process can take a long time to actually detect the data and then, of course, redact it. Once you've got the all finished data set that has been reviewed and redacted, it then needs to be securely shared with the subject, and that can also be problematic. And the last thing, I think, number 10 there, is actually just meeting these deadlines. So each of the regulations that Debbie's just mentioned has slightly different deadlines by which someone has to provide the redacted document. So finding the information itself can take a long time. And then you've got to do the clever stuff I just mentioned about, finding the duplicated information and then redacted. So there's a number of problematic areas. I just want to spend more time just on one last thing before I hand over to Greg, which actually is more linked to health. So we do a lot of work in the UK in the health industry, and this links directly to the HIPAA Act that Debbie was talking about. And risk indicators is a term that we've been told about a number of times. It's relevant to both the UK and the US. So if somebody asks for their medical record, doesn't matter where they are, whether that's in the UK or US, the default position now from the health providers is to redact any information from somebody's past that might cause traumatic events if they were to read that information again. So if someone has a history of a traumatic event, or such as abuse or something else, then the default position is to redact that out. That can be very time consuming, and actually you tend to find that people that end up doing that are frontline clinicians who should be seeing patients. So an awful lot of doctors' times and clinicians' time is actually spent reviewing these very complex cases before they are shared with the patient. So that can take a lot of time. The other one is contamination. You may be surprised about the amount of health records that within them contain someone else's medical records. There was a case literally in a member of my team. His daughter was released from hospital on Friday, discharged on Friday. And in her discharge notes were the medical records of another patient. It happens all the time. It's very problematic, and it's something the regulator really doesn't like. So again, it's a question of how do you develop a process and the technology to minimize the risk of contamination of records. So with that, I'm going to hand over to Greg, who will talk about some of the great work that Xerox are doing generally around helping people transition from paper to digital. And then when he's finished his piece, I'm going to come back on and talk specifically around how Smartbox can solve some of these, really quite complex challenges that I've just outlined. So without further ado, Greg, thank you for joining us today. Really appreciate your involvement, and over to you.
All righty. So Darren, Debbie, thank you both. Certainly appreciate the opportunity to get up and share a little bit about, the direction of Xerox. Darren, if you can go to the next slide, please, that'd be great. At Xerox, whether it's, small, medium business, public sector, national or international company, one of the things that I think is critically important is you're going to see a fundamental shift away from just printing and copying, and you're going to see a focused migration into the document services space. Now, there's a lot of material up here. I'm not going to go into each and every one of these, but the thing that I want to share is this. If you look at all 5 of these buckets, you will see that Xerox is investing more resources and energy and expertise into process automation, into workflow, into capture and content services. Darren, if you could do one mouse click, that'd be awesome. And what that means is now all of a sudden, instead of just hardware, you're starting to see a lot of different offerings and services that we provide to all of our clients, big or small. The thing that we've been talking about, and I know Debbie had mentioned it earlier, and Darren had also spoken on it as well, is a lot of this material focuses in on content, focuses in on security, focuses in on data. And all of these buckets have some type of element that relates to one of those 3 or all of those 3. So we just want to make sure that, you know, all of our clients know, as we continue to invest more energy and resources into these spaces, we are looking at that data, and we're trying to do everything we can to secure and make sure that that data does not get into the hands, or even potentially get into the hands, of people who have no business seeing it. And if you could do one more click, Darren, that'd be great. The last information I want to share on this slide is basically this. For those clients and customers who have worked with Xerox, whether it's 1 year or 20 years or longer, you're probably used to the icon on the bottom left-hand corner, right? Printing, scanning, copying. The reason why this is so important is all the other items that are on that bottom row to the right really start to talk about those document services, right? Smartbox is one of those players, and we want to make sure that we are continuing to focus in on data privacy, data security, because from our perspective, it's not going away. Okay, next slide. I'm going to speed through this one real quick. You know, historically, if you look at it, Xerox is focused on Fortune 500, high volume print and copy. And, you know, what we wanted to make sure here is we see and acknowledge there's a technology shift, right? There's mobile, there's cloud, there's apps, there's cybersecurity, there's data security. All these things have now come to the forefront of the Xerox portfolio and how we work and communicate with our clients. Next mouse click. Actually, you can just bring them both up. That'd be great. The idea here is we want to make sure that we are focused in on a new demographic from the history of Xerox, right? How do we use technology? How do we secure it? How do we make sure that we are discarding content and our technology in a sustainable fashion? The other aspects which have just become, you know, everyday standard shifts in the workplace is hybrid and mobile. Okay, even more reasons how data is now just not sitting in one location, but it's now moving throughout the course of the day from one location to another. So taking care of that data, protecting that data, identifying that data, and using tools to make sure that we have secured it is just as critical as the hardware offerings that we've offered for many, many decades. Next slide, please. And go ahead and go one more. And one more. And lastly, you know, really what I want to try to narrow in and focus on is this right here, right? If you really look at what we're trying to do, to Darren's earlier comment, our focus is the migration from paper to digital, right? We will continue to accommodate our customer base who needs and wants to be able to print for their businesses, but you will continue to see that strategic shift. Right, that is going to allow us to partner with clients, whether it's public sector or commercial today, as well as tomorrow. And rather than go through each of those items in the gray area, I just want to focus on 3 things. Number 1 is AI-based documentation classification. Okay, utilizing AI to be able to look through documents and look through data, printed, electronic, handwritten, to Darren's earlier comment, to be able to understand what that data is and give intelligence to that data. The second item that I think is important is automatic data extraction. Now that we've been able to recognize what that data is, we want to make sure that we can do something with it. There are many tools that we can use. Some of it's barcode, some of it's OCR, some of it's a variety of different other technologies. But once we've been able to understand that data and recognize what it is, then we can secure it. In some cases, we may need to redact it, but when those things like DSARs come in, we want to make sure that we can provide that assistance to automate as much of that as we possibly can. So with that said, those are just a few of the tools that Xerox and our software partners are utilizing every day. I'm pleased to be able to share that we're working with Smartbox, in the DSAR space. And with that, I'll turn it back over to Darren, and then I'll be available for any questions at the end of the presentation.
Great stuff. Thanks, Greg. I think I was going to just stay on this screen for a second, because certainly the work we've been doing with Xerox, particularly in the public sector, and particularly with regard to these large central government departments, that top row is actually critical when you're processing data requests. If you've got a lot of paper in your estate, which public sector tends to have, trying to get that information, trying to capture that information initially can be quite problematic and time consuming. And this is really where we are leaning on Xerox's expertise to make that process, a lot more automated. I can also see one of the areas in grey, data and identity verification. One of the key aspects of data requests is that when a request comes in, the identity of the subject is quite often needs to be verified. And Xerox have an offering to actually do that as well. So as part of the full process stack, what's great about the Xerox and Smartbox proposition is we have pretty much every key aspect covered. So with that, I'm just going to crack on and just talk a bit about how the Smartbox element can really help with the processing of some of these requests. So once you've collected your data, and I said that part is quite difficult, and Xerox can certainly help you with that. They can help you interrogate your data sources using robotic process automation, and they can help you digitize a lot of your paper. But once you've done that and you've collected that data, you need to bring that data set into Smartbox. Okay, so if you liken Smartbox to like an intelligent Dropbox, you won't be far wrong. So you load the data in, or you can directly connect your data set into Smartbox. So we have direct connectivity into the Xerox DocuShare platform already. And we also have direct connectivity into the Microsoft 365 technology stack as well. So depending on where you're keeping your data, we can actually pull that data from some of your data sets. But you need to build that data set, and then you import it into Smartbox. Now, depending on the type of organization that you are, you'll need to consider some email accounts. You'll need to consider some HR accounts. I mentioned enterprise social networks. So we're talking about Teams chats, Slack, live chats that you might have with your subjects. If you're in the medical industry, there'll be almost certainly going to be handwritten notes. And then you're going to have all sorts of different types of data sources that are specific to your organization. So you build your data set by recognizing where that data is and then pull it into Smartbox. Okay. Now, this is where the technology really starts taking the strain. So when that data hits Smartbox, the first thing that we do is convert every file to PDF off the bat. So we do a lot of work with local government in the UK, and we're starting to do some of that in the US. And just that one feature alone is saving organizations an awful lot of time, because often what happens, particularly if Word documents are having to be considered, organizations at the moment are, file save as PDF, and that part can take a long time. So automatically everything is converted to a PDF, and then the magic happens. The technology then is automatically looking for any information that might be personal data. Okay, so personally identifiable information, or PII as it's known in the US. So we're looking for people's names, their job titles, their social security numbers, their cell phone numbers, their bank details, their health record numbers, or anything else that might identify them. we are automatically looking for. Now, to make the technology even more accurate, organizations can upload their own regular expression. So regular expression is an identifier that might be how you identify a particular person. So if it's a payroll number, it could be number, dash, letter. You can upload that string into Smartbox and it automatically looks for any type of string of information that meets that specific criteria. By doing that, you're going to make the accuracy of Smartbox so much better. It's already about 93, 94% accurate. The average human being is about 70% accurate, to kind of give you an idea. So we're already a lot more accurate than human beings alone, because human beings get tired, but you can make that accuracy even greater. And then you can enhance that with your own dictionaries as well. So, if you're in the medical industry, there's lots of terms that are very specific to the medical industry, and you can upload those terms into Smartbox. Or you might have, someone's nickname might need to be considered, or if you work in the police, then you might have your own dictionaries that need to be uploaded. So you upload your regular expressions, you upload your dictionaries, and then Smartbox goes off and looks through these massive data sets that could be, in some cases, we've seen 100 gig. I mean, to kind of put that into perspective, depending on what assumptions you use, 100 gig of data could be the equivalent to 100 filing cabinets full of paper. Okay, so not every case is that big, some are smaller, but if you do have one of these large complex cases, it can take an awful long time to find the PII. Our technology does that without having to do anything. Once it's found it highlights that. It highlights the information it's found, but it highlights it in such a way that it's color coded. So it's very easy for a privacy practitioner, to navigate to certain types of information, to make it easy for them to decide what they want to do with that information, whether they need to redact it or unredact it, or whether it might need, some information might need to be sent to a legal counsel for further review. If that's the case, you can very quickly tag documents, and then you can make those tagged documents available to a subset of people that can then spend time going through those manually if they need to determine if they should be redacted or not. The great thing about that, of course, is that Debbie's already talked about some of the different types of legislation. Each of those types of legislation dictates how data should be considered and redacted. So the way you process a freedom of information request will be very different to how you process an employee DSAR, for example. So some of those subgroups are very useful in determining how particular data should be treated before it is shared with the subject. And then it comes to the disclosure itself. So that disclosure, out the box, our technology sends an encrypted link to the subject. They can download it, but more often than not, the subject actually wants that document to be printed off. So in that case, the document can be saved as a single PDF in chronological order, or of course you can work with someone like Xerox and an off-site print facility. Okay, so that's typically how the disclosures work. When it comes to how it looks, it looks like the image on the screen. So you put your documents into Smartbox, and then, as I said, it's color coded. So a particular color might relate to names, another one might be job titles, social security numbers, addresses, and so on and so forth. So you can very quickly see what types of data is found. And then you can also enhance that with financial information and, like I said, your own regular expressions as well. Now, I mentioned about indicators and contamination. What's really interesting here is that you can do a quick search on risk indicators. So we already have a number out of the box that the technology will automatically navigate to, but you can add your own. And then what happens is, as a practitioner, as a privacy expert, you can then isolate the documents that have these risk indicators mentioned in them, and then you can consider them in a separate area and decide if certain information should be redacted or not. So it's a very efficient way of doing this. We do a lot of work with mental health hospitals, and in some cases, the patients are, repeat offenders of some of the most heinous crimes that you can see. And what the health organization wants to do is to try and limit the time practitioners spend having to read some of this very awful information. So risk indicators can reduce the time it takes to actually review and read some quite traumatic text, because clearly it does have an impact on the practitioner as well. So that just gives you an understanding of I guess, the technology, how it works, and how you can quickly save time by navigating to those areas of risk and contamination. The technology automatically is looking for medical records, and if it finds two different medical numbers in the same data set, it raises a flag and it says, you better have a look at this. There's more than one medical number in here, which suggests that there could be more than one patient's data might be contained in a data set. Then the practitioner can very quickly navigate to the two different records or three different records and decide if indeed they have been muddled up and someone else's medical record needs to be removed from the data set. So again, it makes that contamination management a lot more efficient. So when it comes to best practices, my last slide, and I'll see if there's any questions. Our best practices that we certainly preach is to over collect that data set. Use Lean on Xerox, use their RPA, their robotic process automation technology, to interrogate as many systems as you think it needs to interrogate. Bring the data in vast quantities. The output will be a lot better. Let the technology take the strain. PII, AI is very good at finding personal data, and like I mentioned, it's about 20 to 30% more accurate than humans alone, just because AI doesn't get tired, and you can enhance it with these additional terminologies. The technology is automatically looking for duplicated data. In fact, I didn't say that actually, and it removes duplicated data with a click of a button. So whether that's email threads or exact copies of assets that might be contained in data set, you can remove those very quickly. Our studies have shown that you can typically reduce the size of a data set by about 60%, which is huge if you think about it, because that's directly linked to time savings and gives organizations a lot more time back in their diaries to do something else. We do have a collaboration capability within Smartbox, so multiple people can work on the same data request. This is particularly useful, like I mentioned, if it is health records, or if you're dealing with some of these very large freedom of information requests as well, where multiple people will have to be applying different rules and interpretation of the regulation in different ways. Redaction is key. So our technology certainly enables you to redact across the entire data set at a click of a button. So I'd certainly recommend, huge time savings. We had a customer recently that'd been using Smartbox for just 2 days, and in that 2 days they had performed 2.4 million redactions. If you think how long that would take a human being, that'd take many weeks, and they would probably miss the deadlines that the regulator imposes on them. Make sure that whenever you're sharing that information, you're sharing it compliantly, and you're not opening yourself up to risk. And key to all of this is to make sure you have a very efficient tracking tool. Different regulations have different reporting timelines, so you need to make sure that you have a very robust process to track all those. But most importantly, don't panic. Between us and Xerox, we have this covered. We've built a solution to specifically help organizations process these very complex requests. So don't panic. With that, I'm going to stop sharing my screen. I'm going to ask if anyone has any questions, and also going to ask my panel, my fellow presenters, if there's anything that I've missed or that you'd like to bring to life. So any questions or any other points to mention?
I have a point I want to mention.
Go.
I think the point about the collaboration with the redaction is so vital. The way it happens now is someone may have their own system, say a government agency, for example, and they have a hard time being able to collaborate with other people. So then they do have to end up printing stuff out or calling someone else. So being able to do that collaboration in real time on those documents can definitely help, especially as we see, as you said, there may be multiple different things or multiple different laws that particular documents are subject to, and there may be multiple people that need to look at it. I know in the legal sphere, the statistic I've always read about redaction is that redaction is like 8 times more expensive than anything else. So a redacted document is a very expensive document that you have to deal with. So anything that you can do to leverage technology to do some of that heavy lifting will greatly reduce the cost of dealing with these types of requests.
Actually, just on that about redactions, again, it may surprise people on this call, it may not, but not all redaction technologies are the same. We do a lot of work in all sectors. We had a financial services customer that gave us some sample data of theirs, just to demonstrate or help us demonstrate how Smartbox can help them. The redacted document that they gave us, whilst it looked like it was redacted, by the time it was put into Smartbox, we could read, or our technology could read under the redactions. It wasn't rasterized. A rasterized redaction is when actually you take the data away from under the black highlight. So there's no data there, that's flattened. So there's no data that can possibly be exposed. So again, that's just another thing to look out for when you are choosing your redaction solution. Just don't assume they all do the same job, because they don't. Good. Well, thank you for your time, everybody. We will be making this recording available online in the next 2 or 3 days. But thanks for your time, and we will speak again soon. Thank you, Debbie. Thank you, Greg. Much appreciated.
Thank you. Have a great day.
Thank you.